Good morning, everyone. Today, the chapter which we are going to deal is mental health and drug dependence. And the first part out of it is mental health. So, before going towards mental health, we'll see what is health. Health is defined as a state of complete physical, mental, social, and spiritual well being, not mere absence of disease or infirmity. Just absence of disease does not mean that a person is totally healthy. A perfect health should fulfill all the above components of physical, mental, social, and a newly added one, that is spiritual well-being. What is mental health? It is a balanced development of these two things. One is individual's personality and second is emotional attitude. And these two combinedly enable a man to live harmoniously with his fellow men. Emotional attitudes express the passion of a person, and the pre-existing individual's personality and his passion or emotional attitudes, they enable him to live harmoniously. This is mental health. It is a balanced development of individual's personality and emotional attitudes that enable him to live harmoniously with his fellow men. So what was the method of treatment, or how the people used to treat mentally ill people since ancient times? During ancient or past times, the mentally ill were considered to be affected by devils. Patients were locked in tall jail-like buildings away from the centers of population so that they should not get disturbed. During 20th century, psychiatry started to begin scientific advance. Then the insulin coma therapy, electric shock treatment were used. Then came the use of tranquilizers, which are very widely used now. Tranquilizers means these are the drugs which make people calm or they help them sleep. For example, benzodiazepines, diazepam, alprazolam, etc. So then the idea that mentally ill patients can be admitted in general hospitals developed. Ancient people were more or less superstitious or orthodox. They used to believe in invasion of body by evil spirits, influence of stars and planets, etc. So they believed that the mentally ill were considered to be affected by devils. Now, before stamping a person to be mentally ill, we should know what are the characteristics of a mentally healthy person and what are warning signs of poor mental health. So what are the characteristics of a mentally healthy person? Mental health is not mere absence of mental illness. A mentally healthy person has following characteristics. He feels comfortable with self. He feels reasonably secure and adequate. He neither underestimates nor overestimates his own ability. He accepts his shortcomings and has self-respect. These are the points which reflects a person's relation with self. Being comfortable and secure and having self-respect, they are very important criteria in mental health. So, a healthy person should be comfortable with self, feel secure and adequate with self, should have self-respect. Now, these were the factors with self. Every person has to be healthy socially too. The mentally healthy person feels right towards others. This means that he is able to be interested in others. He has friendships that are satisfying and long-lasting, very important. He is able to like and trust others. He takes responsibility for his neighbors and fellow men. So this is a social person, socially healthy person. The mentally healthy person is able to meet the demands of life. Now this comes regarding his family. He is able to meet the demands of life. He does something about the problems as they arise. He is able to think for himself and to take his own decisions. He accepts his daily responsibilities. And most important, he is not ruined over by his own emotions of fear, love, anger or guilt. So these things, they don't overpower him. Clear? These are the criteria for a mentally healthy person. Now, what are the warning signs of a poor mental health? The person is always worrying, is unable to concentrate because of unrecognized reasons, is continually unhappy without any justifiable cause. Not being able to concentrate or be unhappy are normal, but whenever there is a reason, these things are normal. But being unhappy or unable to concentrate without any reason or without any justifiable cause is not normal. Loses his mental temper easily and often, is troubled by regular insomnia, has wide fluctuations in mood from depression to elation, back to depression, etc. There's some time of the day when a person feels happy or has a sense of well-being, but shortly he gets back to depression. This feeling of well-being and getting back to depression. Continuously dislikes to be with people. Is upset if the routine of his life is disturbed. Every person has a daily fixed routine, but can bear some slight change sometimes. But getting upset if the routine of his life is disturbed is not good. Next is afraid without any real cause, feels that he is always right and other persons are always wrong. This is quite common. Even if you disagree, I would say that we all have this symptom in us. Everyone feels that I am always right and other persons are always wrong. Has numerous aches and pains for which no doctor can find a physical cause. Has body ache, headache, pain in neck, back, feeling of dullness, lethargy, etc. But on examination or on investigations, no physician can find any physical cause. So these are the warning signs of poor mental health. A person is always worrying, unable to concentrate, continually unhappy, short-temperedness, disturbed sleep, wide fluctuations in mood. There's some time of the day when a person feels happy or has a sense of well-being, but shortly he gets back to depression. And continuously dislikes to be with people, upset if the routine of his life is disturbed, is afraid without any real cause, feels that he is always right and other people are always wrong, has numerous aches and pains for which no doctor can find a physical cause. Now these conditions are major warning signs of poor mental health, and help is necessary if the patient has any of these questions. Now we have seen the definition of health, then what is mental health, definition of health, then mental health, then what are the characteristics of a mentally healthy person, then what are the warning signs of poor mental health. You may get a short note of 5 marks on these characteristics or warning signs. Now what are different types of mental illness? There are various mental illness, eating disorders, schizophrenic disorders, anxiety disorders, depression disorders, bipolar mood disorders, personality disorders. But classifying them according to community medicine, we'll have to classify them under 2 groups. One is major illness and second is minor illness. So what are the things in major illness? They are classified into 3 major diseases like schizophrenia, manic depressive psychosis and paranoia. Now going one by one, schizophrenia. What is schizophrenia? It is also called as split personality. Here the patient lives in a dream world of his own. He has delusions, hallucinations, disorganized thinking and speech, cannot organize their thoughts and speak, lack of emotions, lack of facial expressions, and has disabled daily functioning. This is schizophrenia in short. Patient lives in the dream world of his own, has delusions, hallucinations, disorganized thinking, disorganized speech, lack of emotions or lack of facial expressions. Now going further, manic depressive psychosis, also called as bipolar disorder. In these conditions, the symptoms vary from heights of excitement to depths of depression. As I said earlier, wide fluctuations in mood, feeling of well-being, alternating with depression. Paranoia. It is undue and extreme suspicion and a progressive tendency to regard the whole world in a framework of delusions. Again, the thoughts, disorganized thoughts. Here the patient has no trust in others. Paranoid people, they have no trust in others, cannot accept criticism, they are easily offended, they are aggressive, and they have extreme suspicion and a progressive tendency to regard the whole world in a framework of delusions. So these are 3 major illnesses: schizophrenia, manic depressive psychosis, bipolar disorder, stress, anxiety, dementia, insomnia, schizophrenia. Now going towards minor illness. There are 2 main types of minor illness. One is neurosis or psychoneurosis and second one is personality and character disorders. Now neurosis or psychoneurosis, in this the patient is unable to react normally to life situations. He exhibits peculiar symptoms such as morbid fears, compulsions and obsessions. A person is in depression here, gets angry or irritated very easily, is sad, worried, has a sense of guilt, has a sense of low esteem, etc. in psychoneurosis. Now, in personality and character disorders, this group of disorders are caused as a result of unfortunate childhood experiences and perceptions. Clear, here the patient has strange behavior, is suspicious, extreme mood swings. There is difficulty with relationships in people suffering from personality and character disorders, has tendency to hold grudges. Clear, these are two types of minor illnesses: neurosis or psychoneurosis and personality and character disorders. Now, what are different causes of mental illness? Mental illness, like physical illness, is due to multiple causes. For example, organic conditions, heredity, psychosocial factors. Now, organic conditions, mental illness may have their origin in organic conditions such as cerebral arteriosclerosis, neoplasms, metabolic diseases, neurological diseases, endocrinal diseases, chronic diseases such as tuberculosis, leprosy, epilepsy, etc. So these are the organic conditions which may end into mental illness. Heredity. Heredity may be an important factor in some cases. Remember, not in all cases. For example, the child of two schizophrenic parents is 40 times more likely to develop schizophrenia than is the child of healthy person. So schizophrenia is one of the hereditary disease and 40 times more chances to get schizophrenic if both the parents are schizophrenic. Now, psychosocial factors. Psychosocial factors, they are exposure to some toxic substances like carbon disulfide, mercury, tin, lead compounds. Use of psychotropic drugs like barbiturates, alcohol, griseofulvin, etc. Nutritional deficiencies like deficiency of thiamine, pyridoxine, iodine, etc. Exposure to infective agents like measles, rubella, in extreme cases, not all. Traumatic factors like road and occupational accidents. And radiation, nervous system is more sensitive to radiation during the period of neural development. So these are the psychosocial factors: exposure to toxic substances, use of psychotropic drugs, nutritional deficiencies, infective agents, traumatic factors, and radiation. Now, other than them, mental illness, they have some other causes like lack of education, poor employment history, lack of social leisure activities, family or marital factors, substance abuse, antisocial friends and peers, antisocial personality pattern, or antisocial attitudes. Now, what are different crucial points in the life cycle of a human being? There are 5 stages, crucial stages in the life cycle of human being, which can be called as a risk group. Prenatal period. Pregnancy is a stressful period for some women and they need both help, both physically as well as emotionally. First 5 years of life. The roots of mental health are in early childhood, and so every infant or child should have warm and intimate relationship with his mother and father. School child. Everything that happens in school affects the mental health of a child. So, from the standpoints of child's mental health, proper teacher-pupil relationship and climate of the classroom are very important. And adolescence. Change from adolescence to childhood is a stormy period where there are maximum chances of getting ill health. Prenatal period means pregnancy period, first 5 years of life, school child or school age, adolescence, and last is old age. Throughout all these 7 stages, the need of a man are need for affection, the need for belonging, the need for independence, the need for achievement, the need for recognition, approval, need for personal worth, and the need for self-actualization. So these are the basic needs of a person, and if they don't get them, they get disturbed. They go on getting disturbed. Point. The last point, prevention of mental diseases or mental illness. We can divide them into 3 parts: primary prevention, secondary prevention, and tertiary prevention. Now, what is primary prevention? In primary prevention, measures are directed to whole population, especially on those who come with the indications of or risk factors. So it is provided on community basis. As we are dealing this subject with community medicine, we'll have to focus on community basis. It consists of improving social and environmental well-being, promotion of social, emotional and physical well-being. And for this, measures are provided for better living conditions and improved health and welfare resources in community. Secondary prevention. In secondary prevention, a person has started to show some indications or symptoms of well-being. So, measures are directed on those people. It consists of early detection of mental illness and of social and emotional disturbances through screening programs. And where are these screening programs conducted? In schools, universities, industries, etc. And making provision for treatment facilities and effective community resources should be provided. So in primary prevention also we have seen that proper welfare resources should be provided in community. And in secondary prevention, along with this, improvement of social and emotional disturbances through screening programs. Tertiary prevention, here the objective is to reduce the duration of mental illness and thus reduce the stress which these people create on the family and community. Clear? Primary, secondary and tertiary prevention. In general, some other mental health services or the mental health services provided during all these three, primary, secondary, tertiary. One is early diagnosis and treatment, second is rehabilitation, group and individual psychotherapy, mental health education, use of modern psychoactive drugs and aftercare services. Throughout these stages, the treatment or prevention and control measures are early diagnosis and treatment, rehabilitation, group and individual psychotherapy, mental health education, use of modern psychoactive drugs and aftercare services. So while studying this mental health and mental diseases, what are the things we have seen? One is definition of health. Second, mental health definition. What is mental health? Then what are the characteristics of a mentally healthy person? Warning signs of poor mental health. Then what are different types of mental diseases? Major schizophrenia, manic depressive psychosis and paranoia. And in minor, neurosis or psychoneurosis, personality and character disorders. Then what are different causes of mental illnesses? Organic conditions, heredity and psychosocial factors. Now what are the crucial points in the life cycle of human being? Prenatal period, first 5 years of life, school child, adolescence and old age. What are the needs of a person throughout his life? Then preventive measures, primary, secondary and tertiary. In general, mental health services. Now here are some suggestions or advices to me, to you and to everyone. To avoid getting mentally ill. Move your body, try something new. Go outside, get some fresh air. Do something that you enjoy. Connect with a loved one. Be present. Breathe. Take time for breaks. Incorporate fun into your week. Ensure you get proper rest. Very important. Eat balanced meals. Reach out to your loved ones. Make time for the hobbies that you enjoy. Thank you.